Good afternoon and welcome to the 185th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today we have a discussion of the National AIDS Memorial and COVID-19 with John Cunningham. Just a reminder, you can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also watch COVID Calls on Facebook Live and on Periscope. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @USOfDisaster or @COVIDCalls. Please help spread the word and send suggestions for future guests and future topics. Please feel free to suggest yourself as a future guest. As of today, December 10th, 2020, there are 1,577,875 deaths globally from COVID-19, according to the Johns Hopkins University Coronavirus Resource Center. There are 15,526,644 cases in the United States. There are now a total of 291,307 deaths from COVID-19 reported in the United States. That's up from 287,671. It was reported in the New York Times today that the single-day death record from COVID-19 was set yesterday. We seem to be breaking records day by day. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic in some way, and I'd like to continue that now. The headline is Nita, Pippins, a mother to AIDS patients, dies at 93. This was published in the New York Times by Stephen Karutz. It was published May 19th. One day in 1987, Nita Pippins received a call from her only child, Nick, a 33-year-old actor in Manhattan who was dying of AIDS. "Mom, I'm in bed. I can't get out of bed," her son told her. "It's time." Ms. Pippins, a retired nurse living in Pensacola, Florida, put her belongings in a friend's house, took what she could, and moved to New York to care for her son. At age 60, she began an improbable and remarkable second act. Devastated and ashamed by her son's AIDS diagnosis, and troubled that he was gay, Ms. Pippins initially kept the illness a secret from her family and friends, and she felt out of place in the big city. On breaks, while caring for her son, with whom she had moved in, she would sit inside the Nathan's famous restaurant, then in Times Square, and repeat, "I hate New York, I hate New York, I hate New York." But Miss Pippins nursed her son for 3 years as AIDS ravaged his body and he went in and out of the hospital. She saw members of the theater group he had founded and residents of their Midtown building, Manhattan Plaza, falling sick also. And by the time her son died in 1990, Miss Pippins had been transformed. She became close with her son's gay friends and decided to stay in New York. She dedicated herself to AIDS causes. She became a tireless volunteer for Miracle House, a charity that provided out-of-town families of AIDS patients with housing and support. For mothers working through anger, guilt, and sadness, Miss Pippins served as a parent who had been there. For men estranged from their families, she became a replacement mother, sometimes holding their hands as they died. "She didn't come here to be an activist," said Erwin Crute, who met Ms. Pippins through her son's partner, Dennis Daniel, and interviewed her for a possible memoir. "She was filling a void. She was usually with young men who were dying and was, at their request, a go-between for them and their families." Ms. Pippins died on May 10th at Amsterdam Nursing Home in Manhattan. She was 93. The cause was complications of the novel coronavirus, Mr. Crute said. At a time when AIDS was widely misunderstood and gay men who suffered from the disease were treated like pariahs, Ms. Pippins called on countless families across the country to come visit their children. Often those parents had little sense of their sons' lives in the city or how sick they were. Ms. Pippins would tell them to set aside differences and be present for their child. Some took her advice, some didn't. Ms. Pippins would meet wary out-of-towners at the Port Authority bus terminal or the airport and take them to breakfast at a Midtown diner. As a nurse, Ms. Pippins could answer their medical questions. As a mother and someone from a conservative Southern upbringing, she could relate to their fears and concerns of being ostracized back home. At that time, you were shunned if your son died of AIDS, or you had AIDS in your family, Ms. Pippins told New York One in 2010. And I wanted to get together and let them know there were other people having the same problem. For Miss Pippins, her work with AIDS patients was redemptive. I needed to give back, she told Mr. Crute. I needed to have something to do that made me feel better about me. Okay, I'd like to turn to our discussion for today. Let me introduce my guest. I've really been looking forward to this discussion. Let me introduce you to John Cunningham. John Cunningham joined the National AIDS Memorial as executive director in 2009. He's a graduate of the University of California at Berkeley, where he received a degree in political science and organizational behavior. He spent 25 years working for Fortune 500 companies, holding management positions in human resources, risk management, and organizational development. In 1993, he founded and served as president of Golden Gate Granite Group, focusing on human capital management and effectiveness. In 2004, he realigned his career, merging his passion for community activism with his relationship development skills, joining the nonprofit Positive Resource Center as director of development. John has held numerous nonprofit board-level positions, serving as president of the Castro Community Business Alliance, board chair of the New Hampshire AIDS Foundation, vice president of Folsom Street Events, and board member of Positive Resource Center. John Cunningham, thank you so much for making time to join me today on COVID Calls.
Thank you, Scott. It's great to be here.
Let me start the way I usually do, just to find out where you're calling in from and how the pandemic is looking there today.
Well, first, even before I do that, thank you for the story of Nina Pippins. God bless her and so many like her. So where we are today in the Bay Area, we last weekend entered shelter in place again. As many of your viewers may know, the Bay Area was the first in the country to enter shelter in place months ago, and we're back in it right now. We have a number of hospitals that have reached their capacity with ICU. San Francisco, as a major metropolitan city, dodged much of the bullet along the way and was somewhat unscathed in some of the capacity relative to capacity in hospitals. However, that did not continue, and right now there's a real struggle in the city relative to what we see to be the trajectory of the epidemic and the capacity of the hospital systems to take it on.
So the lockdown there now, the second time, do you get a sense of fatigue? I mean, it's hard to make a sort of scientific assessment of it, but what's your own feeling in talking to people? Are they as committed as they were earlier in the year? It's an awful lot to ask of people to do this twice in 1 year.
I think you're exactly right. I think that, and I hearken back, obviously, to the arc of these two pandemics that intersect. The Bay Area has long been, with the AIDS crisis, looked to by the nation and the world as a space and a beacon as to where the solutions come from, whether that be needle exchange back in the day, whether it be PrEP or the like. So the community has always been one that looks after itself and places itself individually second in looking after others, which I think is somewhat baked into our society. So I think that the community in general is leaning in. There are those that are resisting, and certain sheriffs in California that have said that they will not enforce the stay-at-home order. I think that the state of California divided itself into 5 regions. Obviously, we're dealing with an enormous state, the 6th largest GDP in the world. And so any of the regions in the state that dip below a 15% ICU capacity have to go in, are mandatory to go into shelter in place. Right now, the Bay Area is still at 20, but again, as we did in the early days of the COVID crisis, the 6 Bay Area counties decided to proactively enter into that. Last night, Monterey County joined that, even though they're not at the 15%. But we've got LA and Southern California that are sitting in single digits, along with the Imperial Valley and the Central part of the state that are single digits. And then the far northern part of the state is still in the mid-20s, 20% with ICU bed capacity.
I'm glad you already made that connection with the AIDS crisis and the COVID-19 pandemic, because I've talked with lots of people on COVID calls I talked with Esther Chernak, for example, who's a colleague of mine at Drexel and an epidemiologist, and I talked with Peter Chin Hong, who's a physician out there in San Francisco. And they both raised this issue in previous calls about the just the background for cities that really dealt with the AIDS pandemic in the 90s and in the 2000s, or in the 80s, 90s, and 2000s. A lot of those doctors and researchers were very young then, but it seems to have laid in some infrastructure, according to both of them, in different ways. That they had indicated maybe, I think this is what you were saying too. These are places that are particularly maybe well suited to deal with a pandemic and to think about it as a long-term struggle. I don't know what you think about that, but I was intrigued by that observation they both made.
Well, I think you're right. I think we can harken back to the early days of the AIDS crisis, which is 40 years. It's 40 years. We're in the 40-year anniversary.
Right.
And unfortunately, similarly to as we are facing COVID today, we had a government that chose not to respond. We had a president that chose not to respond. We had a president in the form of Ronald Reagan back in the day that chose not to ever utter the word AIDS during his tenure as president. And when his Surgeon General C. Everett Koop did, he was dismissed. It doesn't matter where we all are on the political spectrum. I think we can see today that that's very similar to where we're at. Mm-hmm. So when you look at what occurred in San Francisco, and I'll speak specifically to San Francisco because I know we're going to speak to also the AIDS Memorial Quilt, which was born in San Francisco, and the National AIDS Memorial that was born in San Francisco. I think we can look at how San Francisco responded to the early days of the AIDS crisis. One of our former board members used to use the analogy that we were waiting for the ambulance to come in the form of a public response, a government response, a federalized government response. It became clear there was no ambulance coming. We were left to our own devices. People were dying, people were withering. It took a lot longer in those days for people to pass than it does today with COVID. It was transmitted differently. It wasn't transmitted, and it didn't affect somebody's breathing, which is obviously the core of what we do every single moment of every single day we breathe. But San Francisco responded in the early days of the crisis in what has been now known and called the San Francisco model of care. And the San Francisco model of care is now used by NGOs around the world because of the effectiveness of what it means to have a community engage in coming up with and creating solutions to catastrophic events within their own area, whether that's famine, whether that's irrigation for water in Africa or the like. If the community is engaged in the solution process, then after a government agency or funds are put in, it will in all likelihood have greater propensity to continue. And San Francisco, in the first couple of years of the epidemic of the AIDS crisis, there were over 50 organizations created in individuals' living rooms to meet those unmet needs, to feed people, to house people. Because remember, in those days, the stigma, if you were calling in sick or in any way were suspected by your employer or your landlord of having the GRID, the gay-related infectious disease, right, you would lose your job, you would lose your housing, you would lose everything and be on the street.
It's amazing. So that model, born out of that crisis and that stigma attached to it, is one that even getting the history of that, and that's what we're going to be talking about, getting that history down, getting to where people could actually talk about that experience, even that took some time. Yeah. As well. But we have to learn from those things. I mean, as you pointed out now, we've had a government this year that, at least at the top of the government, rejected this pandemic, rejected the seriousness of it, and literally dismissed his own responsibility early on and said, it's not up to me to do anything about it. I mean, that eerie resonance must be, I don't want to, you tell me how you feel about that.
And before I go on to the viewers that are watching this, last week on World AIDS Day, which was December 1, a week ago Tuesday, we hosted a national conversation. And any of your viewers can go online, and we had Dr. Fauci and Dr. Ho. Dr. Ho in 1996 was the man of the year. He created and discovered the protease inhibitors, and we honored both Fauci and Ho. They were one of the panels. We also had brought in to our conversation activists as well as leaders in major metropolitan cities from across the country. So I think we'll probably touch on that a little bit later. But as you put up on the screen, you can find that at AIDSmemorial.org/WA. So there's a lot of PTSD. I lived in the heart of the Castro district in the darkest days of the epidemic. I was a community organizer while I wasn't working in my full-time job. And that's what people were doing. You would go home, you would go to the neighbor's house that was ill, you would perhaps bring them food. The AIDS virus was brutal in the sense that it affected anything from the brain to the lungs to the eyes. So you would go blind, all of those things. And people began caring for each other and supporting each other and being what oftentimes are called the logical family versus the biological family. Because as you shared with Nina Pippins, many individuals came to New York or San Francisco or Chicago or wherever and left their biological roots to find the village that they could be themselves. And so people ended up showing up and caring for and helping individuals usher to the other side. Well, that is the definition of a natural disaster. That is the definition of a tragic event that causes long-term PTSD. So when COVID has come on, it has unearthed and opened up wounds that have been unhealed and wrapped and bandaged for a long time. As many say that the 80s and the early 90s, I put a lot of that in a box, inside of a box, inside of a box, inside of me, never to open. Well, COVID has forced us to open and look. And that box has the loss of many loved ones. It has the difficulty and tragedy that occurred during those days. And also, my own journey through that process. So I think you're right. It's forced people to look. And unfortunately, what also has occurred is it's forced people because of what has occurred and how it's rolled out and how it's transpiring, with a lack of a government response, with denialism, with stigma, discrimination, and otherism in that process. When you talk about the stigma, the AIDS crisis was being stigmatized from the very get-go when it was first called gay-related infectious disease. So label it that. We've had a president that has called this China virus. So again, stigmatizing it upon a certain segment of society. And I think we all can agree that this is a biological virus that does not discriminate. And so we shouldn't discriminate. But with that being the case, it still brings up that there's a lack of response. But the difference is, I think it's important to look at that our president back then was not responding because, for whatever his own personal and social beliefs, felt that the gay community or the IV drug use community or the sex worker community were perhaps not worthy of the response. That's not the case here. COVID gets into anybody's lungs. And I am so hard pressed to really look at this and see that this lack of response is not because it's a certain segment of society. It's because an individual's ego of not being able to admit that I didn't respond early on in the way that I should have, and or in wearing a mask or any of those things. It's all driven today from the top by the root of an ego.
Yeah, I just want to just pause on that for a second and again sort of really reflect on that connection across time and just spend a second with that. And thank you for sharing the way you described that as a PTSD experience. And as you said, opening up wounds that have been wrapped and bandaged for a long time, which I think is, it's been an important part of a lot of the discussions I've had on COVID calls, is that, these kinds of disasters, they don't end when the government says they're over. And, one also hopes that the mental health impacts of COVID, that we can learn sort of previous lessons, some of what you were just saying.
Right.
The people who have it and survive, the people who had a loved one even who had it and survived, that trauma is real and is going to be part of this experience looking forward.
You're exactly right.
So, John, if you wouldn't mind, let's go back a little bit. I'd like to hear a little bit about your interests and convictions before you started, in your current role with the National AIDS Memorial. I know you were, as you described, you were working a day job. Sounds like a pretty powerful series of day jobs, and then you were also part of an activist community. Say a little bit about that, and then tell us about your kind of life transition into working in nonprofit.
Um, so I'm a gay man, and I was blessed to have a supportive family. I came out in my early 20s, and I was living in the San Francisco Bay Area, and had a very successful career. And when you look at it, so I was doing community organizing, was part of what was known as the Castro Community Business Alliance at the time, which the Castro, for those viewers that are out there, it's sort of ground zero of the San Francisco gay community, but many look at it as ground zero of the gay community in some ways between San Francisco and Greenwich Village in New York. And so I was deeply engaged and involved in what was going on in the community when AIDS hit. And I can remember just vividly that in those days, there were a lot of open parking spaces. There were individuals that were walking on the street that were wasting, that looked like they were probably in their 70s or 80s, but in reality, they were in their 40s or 50s because that's what was going on. There was just abject fear when this first came on. No one knew what it was. And I can remember clearly, of course, we didn't have the internet. So we didn't have that communication tool at our disposal for information. And I can remember vividly at what then Star Pharmacy, which is now Walgreens, that there were posters that were put up with pictures of individuals with Kaposi sarcoma, the lesions on them, and people saying, "We don't know what this is. We don't know what's going on. We don't know what it's about." And so there was a lot of fear in the early days of the crisis because of the way society was responding. There was a lot of early victimization that there was a term that is not used anymore, and that people that live with HIV and AIDS, that is, as I do, I've been living with the virus in my body for well over 25 years. But there in the early days, it was people were referred to as AIDS victims, and so you gave your power up there. I think that what we really saw going on was when we knew that there was not going to be a response. We had already been fighting as a gay community for our own rights in society. We had recently, within years prior, lost Harvey Milk to an assassination in our city hall in San Francisco. At the same time that the Mayor Moscone was also assassinated. Harvey Milk was the first gay citywide elected official elected in the U.S. at that time. So we were already in a place where we had been fighting for our rights, and it basically came down to, at this point, we were not going to allow us to be forgotten in this fight and in this crisis. And so that's where the activist thread came in, and that's where the fight began. To fight for our rights, to fight for government to respond. That's where ACT UP came into the picture. And some of those legacies are starting to play out today. Of course, the problem is that because of the COVID crisis, its transmissibility is so easy that we can't march in the streets. As an old timer, I'm looking for the marching, and it's not there. And hashtags only take you so far. But I think the viewers that choose to go look at the what we presented last week, we had 3 conversations around activism. We had one conversation around activism that had Cleve Jones, who was Harvey Milk's right arm and was the founder of the Zamora Quilt. And then we had Alicia Garza, who is the co-founder of Black Lives Matters. And then we also had Kristen Uquiza, who spoke at the Democratic National Convention, lost her father to COVID, and said that the only mistake my father ever made was believing what Donald Trump was saying. And she's created a new activist movement called Marked by COVID. So it's powerful. That's some of the legacy, I believe, that we've passed along.
I was fortunate enough to speak with Kristen Urquiza on 2 occasions, actually. She gave me a whole hour, which was very generous, as you are. And then she came on just before Thanksgiving and participated in a memorial episode that we did. And she's a powerful
Yeah.
speaker and has a long future in front of her, I think, as an activist. I just want to remind folks you're listening to COVID Calls, and today we're talking about the National AIDS Memorial and COVID-19. I'm talking with John Cunningham as the executive director. And John, tell us a little bit about the history of the National AIDS Memorial, and let's talk a little bit about the quilt and the sort of memorial movement. Everybody is fascinated by it, and what kind of lessons can be drawn from it. And also, particularly, I'm really interested to know what you think about memorials as a sort of form of political action. And we'll get to all that, but maybe just sort of ground us a little bit in the history of the organization.
Sure. Why don't I start off by sort of stating what our mission is of the organization? Mm-hmm. And this is actually a mission statement that was, we just are entering into a new 5-year strategic plan. We brought the quilt into our organization in the last year. And so our new mission statement that was approved several months ago is, by sharing the story of the struggle against HIV and AIDS, we remember in perpetuity the lives lost. We offer healing and hope to survivors, and we inspire new generations of activists in the fight against stigma, denial, and hate for a just future. So that's what we strive to do. And our vision is that never again will a community be harmed because of fear, silence, discrimination, or stigma. So as I said, if we take everybody back 40 years ago, there was a tsunami building off the coast of the Bay Area, or a hurricane in the Gulf of Mexico, or tornadoes that were in the Midwest heading towards Chicago, or a nor'easter going up the East Coast. And I use natural disasters to, again, go back to, this is a virus, it's a natural disaster, and how a nation would respond to a natural disaster, such as a weather disaster or an earthquake, and how that is necessary in this particular case. When that tsunami came across here, or the tornadoes hit, the hurricane hit Houston, the tornado Chicago, Boston hit by the nor'easter, the landscape of that society was forever devastated and transformed. And it will never be the same. Within the gay community, we lost a full generation of just amazingly creative individuals, passionate people that had helped to fight for civil rights and human rights over the years. And they were just basically wiped out. I can remember that in the early days that you would go out and they would not see young people because they were not coming here. They didn't, it was too harsh. So with that being said, 10 years into the epidemic, after many nonprofits in San Francisco had cropped up to meet those unmet needs, it's the prayer of St. Francis, which is San Francisco, right? Where there is injustice, may we find justice, and the like. 10 years in, it was clear that there was a need in the community for a space to be created where we could remember those lost, but that also those that had survived could also gather to find solace and support to carry on into the future. And that is how the National AIDS Memorial, or at that time, a local grassroots, the AIDS Memorial Grove in Golden Gate Park was created. Golden Gate Park is the crown jewel park system of San Francisco. I think it speaks to what was going on at that time, that the city leaders gave this 10 acres to a yet to be formed organization because the city leaders were losing their neighbors, their coworkers. It was just a dark cloud hanging over. Just a short 2 miles away, there was a group of individuals that were gathering together after a march, a candlelight Memorial Day march that took place to remember Harvey Milk. And at that time, when Cleve Jones ended up at Civic Center, he had pieces of paper that he asked people to write the names of individuals they'd lost in that last year, of friends from this new mystery disease. And they put them up on the Federal Building. And when Cleve stepped back from that and looked up, he said, "It looks like a quilt." And he said, "I remember my grandmother made quilts." And so he began that process of looking at wanting to create a quilt. I'll share a story in a minute that connects to Speaker Pelosi around that. But so in San Francisco, within months of each other and within miles of each other, these two different memorial projects were started. the AIDS Memorial Grove was much more of a quiet respite space. It was a derelict, abandoned, forgotten, and neglected part of Golden Gate Park, much like those young boys that it ended up memorializing. But it was a place of solace, a place of quiet. It has won numerous international landscape architecture design awards. It's got redwood groves and babbling brooks. And then 2 miles away was an activist tool. It was the Quilt. And the Quilt was going to begin the process of taking all those lives that were being lost and being put in numbers. And I think that your viewers you just recited the numbers. Every night we hear the numbers. And a memorial is to take those numbers and to make them a life, because it is all so much more than just the number. And so they began to sew. They put a call out, and within weeks, there were thousands of panels of quilt coming in to the small little shop in the Castro district, and these volunteers that had these sewing machines humming together. The Quilt, which is now has over 50,000 individual panels, memorializing well over 100,000, and they are sewn into quilt blocks of 12 by 12s. Each of the individual panels that go on that, there are 8, and they're 3 by 6. They're the size of a grave. And you can go again onto aidsmemorial.org, and you can find your way to our virtual quilt display, which is going on right now for around the country.
So that's, remarkable that, and the way you frame that story too, that it came out of a march, and Cleve Jones's sort of moment of inspiration in which he saw something there. To think about that and connect it with the AIDS quilt that people know today it's a testament to the power of these ideas and the passion of these ideas. And that what you said, the memorial is to take the number and make it a life. That's a lot easier said than done, right, John?
Right. Well, and that's the power of what goes on, and that's about storytelling, right? A memorial is about remembering. Remembering is about never forgetting. And the way that we never forget is we continue to tell the stories of those lives lost, which I know so many are trying to do as they've lost their loved ones this year with COVID. The key to this was there was lack of response. So I was going to said I would share a little bit of this story of Cleve and Speaker Pelosi. And again, you can go to our website. And last year, when the National AIDS Memorial assumed and took over stewardship of the quilt, it was handed off. The formal handoff took place in the Library of Congress, and the quilt went for nearly 2 decades to Atlanta from San Francisco, and was in Atlanta for 2 decades before we reassumed or took stewardship of it and brought it back to the Bay Area last year. In the early days,
it was at the CDC, or it was there as a sort of a mode of speaking to the CDC.
Well, it was an opportunity to speak to the CDC, but it was also an opportunity, again, as making these links to COVID, an opportunity to connect to the African American and Black community of the South that was ravaged because of systemic barriers to health outcomes and stigmatization, as well as their own internalized homophobia within those communities in that way. So it went there for that reason, but it also went there because the Bay Area at that time was in .com. Real estate was expensive. It was requiring more and more space. And it was suffering under financial strain because, again, it was an activist teaching tool. And oftentimes activists aren't thinking about the money. They're thinking about the cause. When Cleve had first started this, he went to Representative Pelosi's home in San Francisco, which I don't think she'd be hosting a lot of people today. Not that she wouldn't want to, but for security reasons. And he said, I've got an idea. I want to create a quilt. And we're going to memorialize it. And you'll see this story. Anybody that watches the video of the Library of Congress, she tells the story from the podium. And she said, I looked at Cleve and I said, Cleve, I'm a Catholic schoolgirl. I was taught to darn, I was taught to sew, I was taught to crochet and macrame and all of those kinds of things. And Cleve, no one sews. What are you thinking? It's an awful idea. And he said, no, this is going to work. I'm going to make this happen. And the genius of this is culturally, quilting sits at the core fabric of our culture. American quilting is at the core. That allows the quilt to go to red counties and places where otherwise it wouldn't, because it'll bring communities out for conversations. So then it started to happen, and they wanted to do a display in DC. And the reason they wanted to do a display in DC is they felt they needed to take those lives that were memorialized deeply in these quilt panels, because keep in mind, these quilt panels were created out of guys' jeans or baseball caps or gloves. I encourage everybody to go to our website. You can, every single one of these blocks is high res. You can go in and search and look. And if you know somebody that you think has a panel, you can type their name in and it'll bring that panel up to you. But he said, I really want this to go to DC. And she said, okay, well, we'll meet with the Parks Commission. And that was at the time Ronald Reagan, and it was James Watt, who was head of Department of the Interior. And they said, we'll give you a little corner over here on the mall in Washington. And then Representative Pelosi, who was fearless, said, I don't think you understand the ask. And she said, no, we want the mall. And they, it's gonna kill the grass. And then she looked and she said, you don't understand. Mothers are sewing like crazy all over this country. Sewing is happening everywhere. America's into sewing. So she went from that place to there. And it ended up, as your viewers have probably seen, it's had 3 major visits on the mall in DC over time. And it took our dead and put them on the front lawn of America. And that day, almost every major city's newspaper and on every single major news network, the quilt and AIDS came home to everybody's living room, and everybody saw what was going on, and they couldn't any longer deny it.
I wonder if you could reflect a little bit on how you see the quilt and those discussions. And I really am impressed with this idea of the creation of the quilt as a long history in the United States as a community developing tool.
Yep.
In which people bring whatever they have. It's old clothing. It's incredibly close to the body. It's incredibly close to the family. And of course, a quilt itself is meant to provide, warmth and shelter and care. There's a lot packed into that, but at the same time, and it's back to what you're saying earlier, the battles, the culture war in the United States over the place of gay Americans in the polity was fierce.
Yep.
So you'll have this. So I guess I want to get back into the politics of that and sort of ask you how you see the quilt playing a role in that transition. And I don't mean to say that homophobia is over in America. We should never characterize it that way. But there has been a strong transition over my lifetime in terms of, the 1980s, as you described, in which there was stigma, and which, the President of the United States himself never used the term AIDS and didn't address it. To get to where we are now is a remarkable political journey. How does the quilt factor into that?
Well, again, as we launched last week this World AIDS Day National Quilt Exhibition, normally the quilt would go out to thousands of locations because it goes out, it tours the country. Any of your viewers, whether it be academic institutions, community groups, if you are interested in bringing the quilt to your community, to both use it as a teaching tool, it is perhaps one of the most powerful social justice teaching tools that's out there, because what it does is it puts out and speaks to what was going on, what happened. It opens up conversations. So if we look at the quilt and the power of what it has today, as I said, the quilt has the capability to go into communities that otherwise would not be open to having a conversation. So right now, as we know, HIV and AIDS is still, obviously it's not over. And it is in the South that it is most prevalent, and that it is devastating communities in Mississippi, in Louisiana, in those areas. So to be able to take the quilt into those communities, because remember, the virus does not discriminate against color of your skin or sexual orientation. And if you have a lot of virus in a community, it's going to move through the community, just like COVID. And so to bring the quilt for display into a community, to then have prevention expertise there, to have conversations, to begin to open dialogue in those communities that are being impacted, and to bring them together and realize we are in this together. That's the power of what the quilt can do. The quilt has toured the world. The quilt was nominated for the Nobel Peace Prize. And so that's really the power as we see it, as we go to the future, is to continue to take it out as a healing mechanism, as well as a mechanism that tells the story of the quilt, of the AIDS crisis, but most importantly tells the story of what it means to be a member of society and the responsibilities that we have to each other. Because I hate to say it, but our society has become so selfish. And the fact that people won't even put on a mask and they say, well, I'm not going to get it. Well, the mask is not about you. It's about your neighbor. And if we can't get to that point, and if we come to the place where we're so just self-absorbed that it's only about me, then the fabric of our society is coming apart at the seams.
I worry about that a lot right now, and I guess it gives me some distress when I think about those lessons that the memorial and the AIDS quilt made available to people to learn from. People like myself who grew up in the South in a time in which homophobia was rampant, and to
Right.
be exposed to that was transformative for me and for many people I know.
Well, right.
And so I feel like, how many times do we have to learn that lesson of compassion? I bring that. That's not even a question. It's just my reaction to what you said. It brings me great distress that we have to be learning that again right now, and we don't seem to be doing a great job at it, frankly.
No, I think you're right. And as you and I had spoken briefly before we came on the air, what are some of the other lessons that are sitting out there? So there's so much collateral damage that happens out of stigma, discrimination, and otherism, especially when it's related to a virus. And if you look back, we know both of these are adversely impacting communities of color because of the distrust, because of the systemic barriers to health outcomes and access to health care and the like. But if you use the example of what happened in the days of the AIDS crisis, it took a young hemophiliac boy by the name of Ryan White to end up being the face of the AIDS crisis and opening some hearts and minds. And if you look at the tragedy that befell the hemophilia community, in the 10-year period, half of the hemophiliacs in America died because they were being infected by blood factor that was derived from blood that was sourced from prisons and from homeless areas that had high potential for infection. The FDA for almost 7 years knew that the blood supply at that time was compromised and allowed it to continue. And so you've got this situation that occurred within that community and the tragedy that befell them because there was stigma over here. They were very, very upset with the gay community. They said, if it wasn't for you, we get help. And they were right. It wasn't that was right, but they were right. And we've worked to bring those communities together and to heal, and worked with Jeannie White, and we've memorialized the hemophilia community within. I also think it's important to talk about the medical side of this, the medical side of treatment. Who are our heroes right now? Dr. Anthony Fauci. Well, where did Dr. Anthony Fauci start? It was with AIDS. That was where it really began. Dr. David Ho, who discovered the protease and how the immune system through virology. And they are now on the front lines. Obviously, we know what Dr. Fauci is doing. Dr. Ho at the Aaron Diamond AIDS Institute and at Columbia University is working to create a similar treatment for COVID as to what was created for HIV and AIDS through protease. The other side of it is, what were some of the benefits that have come out of the AIDS crisis? Well, visitation rights in hospitals. If you are a partner, we can now marry. I'm married to my husband, so I have rights. We had no rights back then. People, therefore, partners and friends were not allowed in. So again, it was the responsibility of those nurses and doctors to hold the hands of those young men, mainly in the early years, that were dying. Similar to COVID. Here we are again. So visitation rights. Getting drugs to market, we write today, the FDA looks as though they're going to approve emergency use authorization for the Pfizer vaccine.
Right.
Before AIDS, there was no emergency use authorization. That came out of the AIDS crisis.
Hmm.
When you look at compassionate use of a drug, how did Donald Trump, Rudy Giuliani, Ben Carson, probably the entire family get access to the monoclonal antibodies? Compassionate use. Where did that come from? That came from AIDS, because at the time there was no other hope at that time. And AIDS patients said, I'm willing to be the guinea pig. And maybe it'll give me some hope, but most importantly, others may be able to be saved by that. That all comes from the AIDS crisis. Those solutions, I think it's so important that we all remember that those are some of the legacies. Those are some of how you remember and memorialize those. I mean, and then lastly, we're looking at, individuals were given access to life-saving drugs, monoclonal antibodies, people who have prestige connections and the like. And I think it's important to remember that Roy Cohn, who was Donald Trump's attorney and was on the McCarthy trials, and was a gay man, extremely homophobic. The incredible film called Angels in America, I encourage anybody to watch, was his story. Well, he got access to AZT before anybody else did. So there are so many parallels going on. I am so hopeful that as we roll out this vaccine for COVID, that there isn't going to be line jumping. That individuals that are in the class that need it get it, and everybody else gets in line. So
I want to remind folks that you're listening to COVID Calls. Talking to John Cunningham today about the National AIDS Memorial. Those historical linkages are profound, John, and I appreciate you going through those. I want to just underline one thing. It brings us up to World AIDS Day. So Tony Fauci, I was talking with Laura Helmuth yesterday, who's the editor of Scientific American, and we were reflecting on the fact that we're in a time again when there are scientists who are household names in America. And it's not by way that any of us would choose, but there is maybe a small glimmer of hope here, that we do recenter science and medicine in American life and take seriously the power of someone, not just as a scientist, but also as a cultural figure, as Fauci. So you had, he was one of the guests in the World AIDS Day.
Correct.
Yeah, say a little bit about that and tell us how you had to modify this event for these pandemic times we're living in.
So Tony Fauci, along with David Ho, as I said, David was Time Magazine Man of the Year in 1996, sat on a panel that was moderated by Dr. Jennifer Ashton, who's the ABC News medical correspondent and Good Morning America as well. She moderated what was about a 40-minute conversation between the two of them, taking them back to the early days of the AIDS crisis and bringing it forward. And it was a powerful conversation. And just to stay with you on your point there, each of the three panels, and I'll touch on the other panels in just a second, the last question they was asked was, those that are viewing, can you provide a message of hope? And both Tony and David both said, we've got to find hope in science. We've got to have hope that we will not continue to turn into a science denialism nation that discounts science, because we're talking on this platform right now because of science. We're able to connect in these ways because of science. And if we start discounting that, we're in real trouble. But it was a powerful, powerful 40-minute conversation. To back up, when we first started into the COVID in April, March, we didn't know how long this was all going to last, right? We thought, we'll navigate through in a few months and we'll be to the other side of this. It became clear in July that what we normally do for World AIDS Day, which is a large in-person tented event in the National Memorial, which is a 10-acre facility, that wasn't going to be possible. So I was going away for 2 weeks with my husband to Lake Tahoe and to isolate in a cabin in the woods. Mm-hmm. And I tasked my team to work on three options and to present them to me as to how we were going to execute World AIDS Day at the back end. And this is what they came back with as their top option, is to create a virtual national conversation. And so that virtual national conversation at its core has the tentacles and threads of what we've gone through over the last 10 months. obviously science and medicine. We had Dr. Fauci and Dr. Ho looking at racial barriers and what the systemic barriers and the George Floyd and what our nation has gone through. We had 4 mayors that were moderated by TJ Holm, also of ABC. So we had Mayor de Blasio of New York. We had Mayor Lightfoot of Chicago, who's a lesbian and harken back. We had Mayor Robert Garcia of Long Beach, who lost his mother and stepfather to COVID. Right. And then we had Mayor Keisha Lance Bottoms, who all spoke about the systemic barriers to health outcomes in marginalized communities and communities of color. So that was the second panel. And then the third panel that we had was on activism, creating social movements for change and good. And that was moderated by Alfonso David, who is the CEO of the Human Rights Campaign, which is LGBT PAC. And he moderated a conversation, as we've said, with Alicia Garza, Kristen Nquiza, and Cleve Jones, talking about activism and how that. So that's where we went. We were so blessed to be able to have so many profound voices in this. And that's one of the silver linings of COVID. We could never have got all those people to come out on an airplane and speak in person, but COVID allows us to do what we're doing right now. I would never have spoken to you before, but COVID has given us this opportunity.
Well, I'm glad it was a success, and the reach of it will be probably greater than it would have been otherwise as well. And that's to the good, of course, not under the circumstances anybody would have chosen. But what a powerful lineup, and the way you describe it. And I guess it brings us also back, and I want to sort of tap into your knowledge now about what we may see going forward with a COVID memorial or COVID memorials. I think we have to move past this idea there's going to be some singular COVID memorial, because where would it even be, and when should it be erected? Those kind of questions that people are not waiting. There are many different powerful memorial initiatives underway. And I guess as you begin to think about those, what kind of advice are you already giving people?
So
and I want to linger on one part of that, particularly as you mentioned the mayors, because there is a powerful resonance across time here about a memorial as a way. When we think about memorials, maybe around wars, but the AIDS quilt is a memorial that forces people to reckon with inequality and hate.
Right.
And there's a lot of that this year that we've seen. It's evident to many Americans who live with it every day, but to lots of other Americans who have the privilege of not being essential workers or not living in places where there's structural racism that they grapple with every day. This has been a year of education for them. What I'm hearing for a lot of people who want COVID memorials is they want those memorials not to be just lists of names, that they need to be spaces of activism. And I feel like you have a particular purchase on that you can share wisdom there. I wonder if you could take us into your thinking about that.
Yeah, I'd be happy to. And the springboard to go in there is, there is something that Alicia Garza said, co-founder of Black Lives Matter, during her panel discussion, and it is, death reorganizes you. And I just think about that for a minute, because I think that for COVID, it's reorganized our nation, it's reorganized our world. I think that Eddie Glaude, who is, I believe, out of Princeton, said something profound a couple weeks ago, talking about where things are at in our nation right now regarding social fabric, and what this has pulled the curtain back to. And it's pulled the curtain back that our social contract with each other was not as strong, I guess, as we thought. And the last time our nation really faced this was when we had significant death and loss. And that was the Civil War. And our nation then started to rebuild itself and rebuild its contract and its agreement with each other. So when you look at a memorial, I think it's important, when you look at the AIDS memorial projects, whether it be the National AIDS Memorial, which is a location-based, or the AIDS Memorial Quilt, which is a artifact-based, it's the largest community art project ever created on Earth. Those memorial projects were created in the middle of what you were memorializing. And I challenge everybody to think about that. What other memorials can you find that were created in the middle? There's some to slavery that were done while slavery was still in existence. But the power of what that means is that those that are creating it for a society that's still going through it, it ends up having significant ownership to what that is about. Because when you're looking at the COVID story, or you're looking at the AIDS story, just as one, and I will never want to draw direct parallels, but when you look at the tragedy of the Holocaust, that's a societal story. And the fact of the matter is that the Holocaust memorials that have been created are so that never again, so that never again. Well, I've got to say, for God's sakes, never again should we stigmatize a disease or a virus, because look what it's done. It's just ravaged, and it's not even near over. And so I think that I actually corresponded this morning with a woman from Seattle that has got a quilting community that wants to start creating COVID quilt. And I've had a couple of correspondence with others around the country. Some have come to us and said, can we jump on your coattails here, and can you start doing a COVID? And that's not our job. Our job is to help to inspire and to help to continue that work. But it's really that communities, and it's got to be the Johnny Appleseed, because the process that we're looking at in a memorial is to tell the stories of those lives tragically lost. And in the process of loved ones telling those stories, they get to heal, but most importantly, they get to honor the lives lost by telling truth to future generations. The quilt continues to receive hundreds of panels every year, hundreds of those that were lost in the day but have not been memorialized. And they come to us in a couple of unique ways. Some of them come to us from nieces and nephews that the grandparents have since died, who would never speak aloud, much like the story and her growth. And so the nieces and nephews want to remember Uncle Bobby because they knew he was a special person. They maybe never met him. And so they today are making panels to somehow honor that. The other panels are coming to us in a very unique way as well, that those grandparents or those parents of the lost, fallen loved one made a panel for their son, and they poured their love into it, and they couldn't give it up. And so then they've passed, and the family finds it on a shelf in the closet. And so it now comes to us. I think that that's the power. This is about communities coming together. We started the Call My Name project into the South, which is focused on the African American and Black community, to work with communities of faith in those communities to bring up and unearth those young men that were lost to AIDS, but that the African American community that has a great deal of internalized homophobia within it never remembered. And so what that Call My Name project is, those young boys from the grave saying, just please call my name, honor me. Because that's what happens when the quilt is on display or when individuals are at the AIDS memorial, is it is a reading of names. But I think it's a unique thing historically and sociologically of memorials being created in the middle of what you're memorializing.
So it sounds like, I mean, so first of all, your advice here is nobody should be waiting until this is somehow over, but that there's something powerful about people, the resonance there of the beginning, the making, the thinking about it as part of the experience of the grieving. But also, just to come back, because it's really important what you said, I think. We have this notion that, you know, memorials and monuments live in Washington. Maybe they live in a state house, but, you know, Washington, and even when the AIDS quilt, maybe in one of its, you said it's been to the National Mall 3 times, and those were powerful moments for it.
Right.
But the making of it is individual. It's families making it. It's friends, loved ones making it. And I'm assuming communities coming together and making panels as well. And the way you describe that they still come in is, I hadn't heard that. It's really astounding and remarkable. That's not the way we have often been taught to think about how we mark important events in American history. All right, that if to really mark those events, it's got to be the Lincoln Memorial. It's got to be the Vietnam Veterans Memorial with the names carved in stone. You're talking about something very different, a very different approach. And it also, I wonder about that a little bit, because it strikes me that what you're describing is the memorial is the conversation.
Correct.
and the time of that creation. So that's a learning moment. And the quilt, of course, the quilt is enormously valuable, but maybe that's not the most valuable part of it. It's the making that's the valuable part.
It's the making, and then it's the sharing, right?
Yeah.
It's about healing. And right now within the COVID community and our nation, there is such unresolved grief because so many family members were unable to in any way be close to their loved one at the end. And so that process of being able to find a way to connect with that, I would venture to say that doctors and nurses will start creating panels to the loved ones they nurse to the end, because that's the power. It's the power of individuals coming together, working together to remember and memorialize, because that's where the healing happens. A memorial is about telling a story, but it's also about healing. And there's so much unresolved grief and healing out there. We're in the process of looking at, in our new strategic plan, creating a national registry of the names lost, because there are over nearly 700,000 individuals in the US estimated that have died of AIDS. Of course, it's probably well over 1 million, because many didn't die of AIDS in the early years. They died of cancer, or they died whatever their family wanted to say. Right. Much like the Shoah Project or at Yad Vashem, the tragedy and the disaster that happened and befell through the Holocaust, they're still trying to catalog everybody that was lost. Well, this is going to be an ongoing thing for us as well. And COVID will find the same, right? Because many people are dying from other causes that would not have otherwise died were it not for COVID. And that can be that they got COVID before it was all diagnosed, or they died of a heart attack because they couldn't get into the hospital because it was full.
Right.
And it also, so it is the act. The National AIDS Memorial has over 250,000 volunteer hours that were dedicated to the creation of the space. This memorial was not created by a government agency that decided to build something like
architectural jury and all of that sort of thing.
This was created by the community, with the community, because, as I like to say, the healing happened on either side of the shovel as they were working to till the land, transform the landscape. Because, as I say, the healing happened not only on either side of the landscape, but as that landscape was transformed, so were the lives of the individuals doing the work.
We're almost up on time, but I want to just come back to one thing, so that because I want to linger on the challenge of this. It's been surprising, I think, to many people that, and Kristen Urquiza has talked about this. There have been pushback against Memorial this year. I mean, frankly, there's been pushback from the top of our government as to even the death count.
Right.
And so, I think it's important, and to give you a chance to comment on this, the quilt has not been welcomed in every community and by every politician. The memorial acts around, AIDS there's still some probably who push back on it, who deny. And I guess I think you must have some special wisdom there to share with people who want to make COVID memorials, because I think it's going to be a long road, frankly. And I've seen things in America this year. I wouldn't think anything would still surprise me. But when you said this earlier, that social contract is frayed a little bit. There's going to be pushback against COVID memorials. I think there already has been.
Yeah.
How does solidarity work in this case? I mean, it's not just going to be a case where people are going to make a great memorial and everybody's going to say, "Great, we honor those dead." We've seen surprising reluctance, I think.
I think I think you're exactly right, and I think it's there's not an either or. So yes, the quilt is a national treasure, and it does speak to a nation, because there are blocks and panels from every state. The National AIDS Memorial received federal designation from the federal government as a result of the bill of Congress and signed into law by President Clinton. But also, there are AIDS memorials. There are well over 150 of them around the country in small communities that have a rose garden. Or in the case of New York, they've now got the AIDS Memorial in New York, or the new one going in Seattle called the AIDS Memorial Pathway, or West Hollywood, California, where there's an AIDS monument, or Los Miros, which is in West LA, which is dedicated mainly to the Latin community that was impacted. So the reality of it is yes, I hope there will be some sort of a a profound national story, but on the other or memorial, but on the other side, communities need to do what communities need to do, and to honor the lives lost and honor those also that help serve them in the form again of doctors and nurses, because that's where the heroes of COVID are, as they were with AIDS. It was those doctors and nurses that entered those rooms when no one else would. And I'll just leave your viewers with one thing. One of our board members, who lives in Austin, Texas, and has been living with AIDS for a very long time. He recalls when he was in Atlanta in the hospital and didn't think he would live, running with about 107-degree temperature, packed in ice to keep him alive. They had taken him out. He was in his room, and a nurse walked in without face masks, without gloves, without protective equipment, put her hand on his shoulder and said, "Honey, you're going to be okay." And it gave him the will to continue on. And he now runs an amazing organization and is part of our community in a profound way. We give each other help and hope through individual acts of kindness. So if there's anything we can do, is to continue to share kindness with others.
That's a tremendous story. And as we close out, maybe, John, I've just put back up the www.aidsmemorial.org/WAD 2020 for people who want to see these videos that you've collected there from your online event that you had this year because of COVID. And just maybe tell us what else we'll find at the website as we close out.
Yeah, so I would actually encourage everybody to take the /WAD 2020 off and just go straight to the website at this point, aidsmemorial.org. It is a storytelling platform because, again, that's what memorials are about, is keeping the lives alive through storytelling. It talks about the heroes. It talks about those that have been involved over the decades from the AIDS crisis, as well as activists, as well as politicians, as well as others. It also, we have the Pedro Zamora Young Leader Scholarship Program. Some may remember Pedro Zamora was in this season 2 of The Real World. He was a Latin AIDS activist from South Florida and died just 2 weeks after the airing of the last episode of season 2. We scholarship young leaders of the future on college campuses who are doing groundbreaking work in the area of HIV and AIDS prevention, social justice, human rights, reproductive health. And then we also continue to do our work as it relates to the Quilt. So you'll find a myriad of really dynamic information on that site. We just relaunched it earlier this year. It was, again, something we were able to do during COVID because we were somewhat all isolated, and it's a powerful storytelling platform.
Well, just a reminder, everybody should check that out. And I think you're going to be, I know you're busy in an ordinary year, but it strikes me you're going to be incredibly busy going into next year, John, as people trying to make sense of COVID and trying to make sense of it by way of this history that we've been discussing today of AIDS and the AIDS Memorial and the AIDS Quilt. I want to thank you for joining me today. And I want to remind everybody that you can catch COVID Calls every weekday, 5 p.m. Eastern Time. Tomorrow we'll be talking about the saga of COVID testing, and we'll be talking about that from multiple different national perspectives with historian Shobita Partha-Sarathy, who's at the University of Michigan. So please do join me for that. And John, thanks a million for this call today. Just a wonderful hour of learning for me and for the others who are watching.
Thank you so much, Scott. And again, for anybody that would be interested, when we can gather again, of bringing the quilt to your community, we're happy to bring it to your community. So aidsmemorial.org, you can help to bring it to your town.
Stay healthy, everybody. We'll see you tomorrow, 5 o'clock.
Thank you.